Hello everyone, Maria Trusa, the CEO of Forme Medical Center. Today, as I'm here with Dr. Arad, thanks so much for joining us.
Thank you for having me.
You all know that we at Forme Medical Center are very committed to making a difference in our community. And one of the biggest problems, not just in this community, but in the country, is the fact that we have obesity at the highest rate and increasing at levels that are pretty scary for all of us. So we want to do, at Forme, we're trying to figure out a comprehensive way to help patients figure out what works for them when it comes to really getting the weight off and committing themselves to a healthy life. And I asked Dr. Arad, who, by the way, we're talking about doing some telemedicine consults. So many of you will be able to do consultations through your phone. And in addition to that, we're talking about doing telemedicine for groups. So we'll let you know when that is happening. But today I want to ask Dr. Arad, that it is very difficult for patients, right, to make the decision even to get to the consult level.
It is very difficult. On average, most people, it takes around 1 to 3 years once they've decided that they would like something to actually get to surgery.
Incredible. In making that step, and I always think about how just getting the information, it shouldn't be that difficult. Just get out there, get the information, and then obviously you don't force anyone to have the surgery. It is their choice.
Absolutely. It's definitely always the patient's choice. My role is to describe the different options that exist, and if the patient decides that they would like to pursue one of those, then I'm there to help.
Great. So talking about options, can you give me the different options and then talk about the one that is the most common one as far as the surgeries?
Sure. So the major surgeries that now exist are what's called the laparoscopic gastric band, the vertical sleeve gastrectomy, which is also commonly known as the sleeve, and the Roux-en-Y gastric bypass. The most common surgery nowadays done by far is the sleeve. It's a very quick surgery. It takes about an hour, hour and a half. Most patients are home either the next day or the day after. And
how long would it take them to go back to work after the surgery?
For most people, they're back to work the next week. For people who do things where it requires heavy lifting, then it follows the same general principles of any surgery, where we wouldn't want them lifting anything more than 10 pounds for 6 weeks. But that's more so from the abdominal incisions than the actual surgery.
Got it.
The gastric band is another option, where a device is placed around the top part of the stomach and it's adjusted depending on what the patient needs. But the most common surgery by far is the sleeve. It works great.
Can you tell me a little bit about it? Like, how does it work?
Sure. So the sleeve is done either robotically or laparoscopically. I'm the chief of robotics at St. John's Riverside Hospital. I also do the surgeries as well at Nyack Hospital. And the stomach is freed from its surrounding structures. A tube is placed down into the stomach in the middle of surgery. It's called a bougie. And that is our guide to turning the stomach into a banana-shaped stomach. We staple off about 65% of the stomach, we remove it, and then we test the staple line to make sure that everything is in place. The next day, we usually do a radiology study to also confirm that everything has flowed through and that there's no other complications. And that's it. It's a pretty successful surgery.
That's so you find that a lot of people are actually choosing this surgery, and that is one of the most successful one as far as keeping your weight down.
By far, because not only does it allow for restriction because you have less stomach, you're not able to eat as much, but there's a hormone called ghrelin, which is a main hunger hormone. It's not the only one, but it's one of the main hunger hormones that by removing the part of the stomach that you're removing with a sleeve, people are not as hungry. They have what's called early satiety. You have what you're supposed to eat and you're full. So you're not rushing to the fridge. You don't have that urge anymore.
Wow. I mean, it's pretty amazing. Obviously, we could talk forever and there is so much to cover, but I'm just hoping that we have, you know, given you a little curiosity and try for you to find out if this is the choice for you. I remember when I was talking to you, you mentioned something about the expectancy of death or the death rate depending on the BMI. And can you just quickly tell me a little bit about that, because I found it amazing information.
So with a BMI of 40 and above, or 35 with a comorbidity, which is usually diabetes, high blood pressure, heart disease, or sleep apnea, the death rate almost doubles or triples. All those diseases are directly associated with obesity. You don't have to be obese to have them, but as someone's BMI increases, they are significantly prevalent. And with these surgeries, you can actually stop the progression or actually create regression, reverting the patient back where sometimes they don't have to take any of their medication.
Wow.
It's really, really great.
So, but, and I remember you also saying that the expectancy could be 55 years old.
Yes, there's a lot of people who, you know, just because of obesity, the life expectancy is, you know, 55, 57 years old, and it's from obesity. You know, it takes, you know, 10, 20 years off of some people's lives. And if you catch it early enough and you're able to prevent it, then you provide a prolonged, more quality of life for that patient.
Great. Thank you so much for the information, and we look forward to working with you
Me as well.
and really helping our community. Thank you so much for listening to us, and I hope that we are making a difference in your life.
Thank you
Take
very
care.
much.
Bye-bye.